we all need therapy, man. Like, people are like, there's a problem. No, sometimes therapy could be like, I'm doing great right now. I just want to be better. How can I be better? But we look at therapy like, oh, there's an issue. What's wrong with me?
Down, it's time to focus on myself, and I'm committed, fully adapt and overcome. Stay ready, always fit for duty.
That's why people with the camera, the intros going on, they're like smiling, but I'm just like, let's just keep it real. It's just a conversation. You know what I mean? So
that's what I like too, because a lot of times, like I'm a therapist and I'm a psychologist, and I like that people are like, sometimes my peer supporters are like, are you a real therapist? I'm like, what do you mean, as opposed to a fake therapist? And they're like, well, I don't know. You don't throw like psychobabble at me. You're not trying to tell me what to do. And I'm like, no, dude, we have to keep it real. Like, we have to keep it real, because I can learn all this stuff at school. And at the end of the day, it's like, you can hear it and it goes over your head, or you can hear it and go, all right, let me do something about this. And let me like figure it out. So, yeah, no, I'm all about like, and at first it was like, oh, I need to perform, or I need to have the right answers. And I'm like, I just have to be me. And I know enough about a little bit about everything. And then again, with exposure and going through things, and it's like, okay, I can figure it out, and I could still be me. Right? Like, you're you. And we've had these conversations of like, hey, I'm doing this. Hey, I'm doing this. Okay, let's figure this out. And like, all right, be flexible enough to like go with it. So yeah, I'm all about that.
no, I love that. And I was actually just having that same conversation with the last people that we had on. There is a therapist from, I would say, like Northeast, but it's called Protein, and they do like not rehabilitation, they do pretty much like physical therapy for first responders, like kind of like sports athletes, but for first responders. That's a pretty badass program. But she was telling me how, I was telling her the same thing. Like, I just like, when it comes to helping the first responder, I feel like the best way you could do it is just be real with them. And so I was telling her, like, how are you guys do your program? Because I like, she's on the podcast, whatnot. How do you guys approach your first responders? Is it more like, hey, we're here to help you? Or is it more like, hey, you're fat, like, we need to fix this? Yeah, you have lower back pain because you're fat. It's like, you know what I mean? Let's not beat around the bush here. And me being a fitness coach for over 15 years now, and I worked a lot of first responders, a lot of cops, and like, doing the job in the military. And his stepfather is like, he's a correctional officer, but I don't like beating around the bush, because he, like, I was telling her the example. I was like, if a cop's coming to you and telling you like, hey, my sciatica is, really in pain, and this is happening, that's happening, and there could be a lot of factors that come to it. But at the end of the day, if we could take off 30 pounds, it might help that 80%, or even actually fix the problem, And so for me as a coach, I used to do busy parents at I used to market to busy parents, and I kind of hated it, because it was more like I was being Coach Gail, which was really nice. Like, hey, oh yeah, it's okay. Like, I completely understand you. I'm a parent too. But at the end of the day, when I wasn't talking to them, even being a parent myself and working the job and running the business, I didn't give myself that kind of talk. It was more just like, hey, we have to fucking do it regardless if it's better. But I'm over here being nice to these clients, and I felt like I was doing a disservice, because I didn't know how to speak their language. But now I work with first responders, I just switched. I was like, no, I'm just gonna I need to focus on my people. And now I could be more upfront, because they need to hear the more upfront things, because it's the only way it's gonna help them. And if helping and saving their life, or helping them and saving like them from chronic pain, you just have to be upfront. I can't beat around the bush. And she was telling me, she's like, no, yeah, it's true. Like, she's like, I feel like we're pretty upfront, but that, but we try to do it, in a good way. And I was like, no, just tell them the truth. Like, it just, some people have to hear it. If they don't want to hear it, and that's up to them. But same thing, that's the reason why I fell in love with my therapist when I was going through my stigma. Because if someone was beating on the bush with me as a therapist, and I think she's a doctor, so she's a psychologist, yeah.
Yeah.
And so she's on that level, but I still call her I don't know.
Well, we're all therapists in that like umbrella term. And then depending on your licensure, right? And a lot of times people are like, well, what's the difference? Like, a therapist is a therapist, but it's just the lens in which you learn how to do something, right? So you can be your cop, but then you have a specialty. You're part of the NARC team. You're part of this team. You're part of that team. So we're all therapists, helpers. But we look at it through the social worker lens, through the LMFT, the licensed marriage family therapist lens, through the psychologist lens, and then the psychiatric lens gives more meds. They're not here to talk about your problem. They're here to figure out which medication you need that's going to help you. And the really best psychiatrists, they don't prescribe meds. They look at it from a holistic point of view. And then they're like, okay, you might need this for temporarily, like, like your little training wheels to kind of get you back on, but you don't need this long term.
Exactly.
And there's a lot of good psychiatrists out there, and there's a lot of not so good psychiatrists out there.
Exactly.
And the same with any profession, right? But I think sometimes like we're like, is she a psychologist or a therapist? What's the difference? Psychologists, they learn more about like individual, more brain-based kind of stuff, more individual. And then family therapists, like couples or families, like they're like, oh, we have to do mandatory children and families. And then social workers look at it more macro. So if you go see like a licensed social worker, they might look at it and say, what's going on in your department, in your community. Now, if you're like, I don't give a shit about my department, like that's why I'm here to see you, right? Then that might not be a good fit. Or if you're like, I don't want to work on my marriage stuff. I want more like how to fix my brain. And the best people are the ones, like you said, have integrity of just like keeping it real. And in using a little bit of this, a little bit of that, a little bit of that, and kind of seeing like what you need, or like a specialist that says, I'm trained in EMDR and you need this and this is why it helps. And, sometimes we like to throw little jargons out there. And I think every community likes to throw jargons where like, acronyms and this. And so if you're a first responder and you're like, hey man, you need therapy. One, that's like, we all need therapy, man. Like, people are like, there's a problem. No, sometimes therapy could be like, I'm doing great right now. I just want to be better. How can I be better? But we look at therapy like, oh, there's an issue. What's wrong with me? We live in a human life. We live. There's going to be stuff that we can have someone from an outside perspective kind of give us like their insider thoughts. But like you said, it's so important to find that right fit, the right match. A lot of times it takes a few people to interview. I remember when I was doing my internship, that's why I like to help first responders. Cause I'm like, I think I have my shit together. Right. So I'm learning, I'm going to school. They're like, everybody here needs therapy. And so I'm like, why do I need therapy? There's nothing wrong with me. So of course, like I interviewed 15 therapists and I'm like, okay, this one's not good. This one's not good. And finally I was like, man, I went to go see one and all she did was turn around the computer and like type. And she turned around and she gave me a diagnosis. And I was like, I don't have that. And she's like, well, of course you do. Look at your childhood. Look at this. Look at that. And I'm like, I left that meeting. I was like, man, I'm so screwed up right now. Like, I don't know what's going to happen to me. And I left like really disillusioned. And then when I found the right person, I was like, you know what? Like that was disservice right there. That lady did not get me or take the time to get to know me. And I'm glad that my school kind of mandated me, because if it wasn't for that, that would have been probably my only experience. And I probably would not have been a therapist. But luckily the next interview that I did, this lady, I love her because she took off her shoes in session. And she sat there Indian style and she looked at her clock and she's like, all right, we're going to get started. The part of me was like, what's wrong with this lady? She's not professional. What is she doing? Right. But then I liked her because she gave me some tools and I'm like, I kind of like that she keeps it real with me. She's not here to bullshit me. She's not here to tell me that. She's really like, this is who I am. And if you like me, come see me. And if you don't, there's the door.
I like that.
So I kept going back. And then, and then I feel like she shaped me and other experiences that I've had along the way. And so I am like an LMFT. I'm a psychologist and I'm like, okay, at the end of the day, I'm me. And I'm me that's like been through all these experiences. So at the end of the day, the cop or the firefighter, right? That's like the uniform you put on to do the job. But it becomes so ingrained in us, like that's who you are, that you carry all this stuff. And so for me, it's so important to like get out there and be like, we are helpers of helper. Like we are helpers helping the community, but we got to help ourselves. And like you said, we have to help our own people because the stuff that we're dealing with, it's not normal. Like it's not normal. And it becomes so normal. Yesterday I was like, oh yeah, I got a call for a pediatric death and I'm going to go do this. And one of my friends was like, oh, I'm like, shoot, I just like triggered her because for me, it was like just a normal part of my day. And I had to like step back and I like to do like pattern interrupt, little timeout and go, wait a minute, this is not normal. This is definitely not normal for the average person. And one, I just probably said a little too much to her. She can't handle that. And that's okay. And let me step back and go, what about that makes it normal to me? Because I've been a trauma therapist for so many years. So first responders, the same thing. how many calls do you get, right? The average, the top 10, we all hear about them. We know about them. And they're like horrible situations. The average person goes through one in their lifetime, if that, if that. First responder, 15 to 30 per shift right now. I'm like, dude, that is not normal. Like, what is going to happen to your brain? So we forget, right? Our brain is a little organ. We have the amygdala. Did you know that the normal size amygdala is like, it's supposed to be like an almond. I wish I had an almond right now to show you because I love that. It's supposed to be an almond. You know, every first responder, what the shape is?
Norton?
It's a walnut. A walnut.
Damn.
Like, so take a look at I wish I had it right here. I eat walnuts, so they're not in the shell, right? But that's what they look like, all
It's like
crumbly.
double the
That's our
size.
brain. Yeah. So imagine if every day you're like, I'm exposed to that. I'm exposed to that. I'm exposed. What's that going to do to you? Martin Luther King said, darkness brings out darkness, right?
Mm-hmm.
So we need light. We need light. Like, how are we going to bring light? What are we going to do? Sometimes the light's not within us because we're exposed to so much. We need those resources. We need those people around us. We need the therapist, the psychologist, the psychiatrist, your coach, your peer support. I'm big on peer support because you understand what someone else went through. And I do a lot of those certifications, and, you know, people say, well, I'm not a real first responder, right? I'm a therapist of the helpers. But I'm like, oh, I deal with trauma. So first responders need first responders. You know what it's like to shoot someone, to chase someone, to do that. I don't. I'm like trying to talk my way out of it, right? But that's when you guys need those helpers, like the light. And like you said earlier, nobody wants to go and be like, oh, I have a problem. Like, even me, I was like, I'm good, right? I'm good. The famous I'm good. How are you doing, man? I'm good. Yeah, we just went through hell together, but we're good. So I'm always like, wait, you're not good. I'm not good. We're not good. And if we're good, then we have to be okay with saying we're not good because we're lying to ourselves. And that's what happens, is accumulation of lying to ourselves. Like, we're good. What do? We numb, right? How do we numb? What's socially acceptable? Drugs and alcohol mainly. We look at it goes hand in hand, right? And when you look at, like, I don't know, and I have to work on this, right? Because I get so angry because I'm like, how is it with first responders? The number one occupational hazard is suicide. Like, how? How does that happen? But again, if you look at it like the darkness, no one calls 911. Like, I'm having a really great day. I just want to say thank you guys. Like, how? You're like, sometimes I wish that happened. It's only like on TV or, you know, some big incident and people come together. They're like, oh, we love the cops. We love the firefighters just for this. And then it dies down and you're like, back to reality here. So for me, it's like, what can we do? One, like you said, reduce the stigma. If we just talk about it, have a conversation about it. And, you know, thank you for inviting me because, yeah, sometimes I like get passionate about it. And then I'm like, let's do something about this. You know, let's help our people heal.
No, exactly. I want to get into what you talked about because it's been a big topic the last few episodes. I have a few episodes that haven't been put out yet, but from the last few episodes, we talked about peer support. And for me, doing the job and then my take on it is a little different from your take. But I love how passionate you are, so I kind of want to dive deep into that to see where that passion is coming from. Just like I've been trying to find me, my co-host Jessica and Taylor. We've been talking about peer support. We try to get someone who's a lead in peer support to get on, but they've been having some issues with getting on in the department itself. But what about peer support do you like that makes you really passionate about it?
Well, here's the thing with peer support, right? There's a lot of people that say, I'm peer support. I'm peer support. One, are you trained in the right way for peer support? Like, are you trained on the ICISF model? Do you know how to do proper CISM and like the steps? And part of the steps is like when to refer out. Part of the step is like what resources are there. The other part of it though is you have that training. What other training have you had? And I don't have it here. Actually, I do. What other training have you had that you know goes like above you to help someone else? So I can give you my experience, my knowledge. I can tell you, hey, I know this, I know that, but I can only lead you to as far as I've gone. So that's a few, the trainings, right? The ICSF, peer support, we have others. And third, which is probably the most important, do I trust you? And are you a good person? Are you a good leader? And I think that's where it comes into play. Like, some people say, screw peer support. I'm not going to call them. Last time I called them, they told someone else. we know confidentiality is huge. Right now, some states, I'm so glad they have this, like there's peer support laws, because I've heard some horrible cases where they're like, well, you told peer support what happened in your incident? All right, we're going to mandate you to come in and tell us what officer so-and-so said, what firefighter so-and-so, what dispatch said. Now you just killed the whole program, man.
Yeah.
Like now no one's talking, right? And I love how we're all talking or we're like never going to talk again.
Mm-hmm.
So I think it's important though, when we get into like always and never, that's a wall. And usually it's fuck you walls, right? Fuck you guys, fuck the department, fuck therapists, fuck everybody. Oh yeah. I'm like, okay, I'm in there too, right? I'm in the mix, right? So we have to go back and go, okay, that's my wall because of that one experience I had. Now, maybe that wasn't the right peer supporter that was matched with me. Maybe I need to change. Who do I really trust? So again, who's my top 5? Is there anyone here in my station that I trust? Now, have they been trained? Do they know how to do that? And so for me, a lot of times I tell people that I meet, I'm like, hey, you'll be good peer support. Here's a training you need to take. Here's another training you need to take. Here's another training, just to give you the basic knowledge of what to do when you're confronted with certain situations. And then from there, go on, because you have that integrity, you have that honesty, and you care. Now, you want to be a helper of helpers. You want to help your own people. You also have to help yourself. And that's the hardest part, because you're like, oh, I'm good. I'll be peer support to others, but I don't need it. I mean, this year alone, the last like calendar year, I've had so many peer supporters reach out to me because they're like, Maribel, I'm not okay. Like I give, I'm not okay. And I'm like, time out, dude. We got to give to ourselves. You know, we hear peer supporters now like killing themselves, and you're like, but he was a peer support. He knew better. So we can have all the knowledge. We can be in integrity. We want to help. But if we don't help ourselves, then again, we're digging ourselves like, you know, our own grave, basically. Because what goes? Our bodies, our relationships, our families, our money, everything. And then what do we turn to? Our vices, right? It's easy. Addictions, vices, whatever they might be, you know? So it's kind of like goes hand in hand. So for me, a peer supporter needs to have those things. And then you look at who my department do I trust? And if you do, then that person's going to understand you because they've been on those calls. They've seen those things. They work in your department. I used to work for LA City Fire. So when someone says fire station number 3, number 9, I know that. I kind of know who's there. I know how the department runs. I know the culture of it. You know, it's different than another department up north or PD department. And you look at the differences, right? But someone that works within your department, they get it. And you look at micro, macro. I like to look at it and zoom in and zoom out. Micro is within my department, within my people. And then you zoom out and go, who else? So you can be a peer supporter to another cop in California, in Texas. And that's macro. But because they're like, I like Gilbert, I like his style, I trust him. And then you have enough skills and knowledge to say like, I got this, I can help them, and still set my boundaries to help myself first. And I think that's the hardest part, right? With peer supporters, like they want to help everybody, and then they start struggling, and then they say, I can't tell people I'm struggling because I'm a peer supporter. And like, dude, you're a peer supporter. Like, it's okay to say, I'm not okay. I actually just had a call from someone this morning. The wife had a call because he was like, I'm a peer supporter. I don't want Dr. Maribel to know I need help. I was like, oh my God, like of course I want to help you. Like no questions, no admissions, just call me. We're going to set up. You go straight to the front of the line. You don't have to wait back there. You're not general population, and you're a peer supporter of your helpers. Like your peer support lead, you're first, buddy. But a lot of times, and he's been struggling for a while. So he's like, oh, no, I'm good. And oh, what are they going to say about me now? And I think that's what we have to live with. Like, it's okay to not be okay. And even for me, when I told, last year we had someone kill himself, and I was like, dude, like, I am not okay, guys. Like, I need a debriefing. And they're like, but you know what to do. And I'm like, yeah, but I'm the client right now. I'm affected. Like, I'm having nightmares. I'm having this. And the difference between me and another person is I can recognize it faster because I'm a therapist. I've been trained to do that. So you guys have been trained to do a certain job. And now it's like mental health, right? So peer supporter, my goal is to train peer supporters to be able to recognize it, to go, I'm not okay. My buddy's not okay. Let's do something about it. So I want to share something with you. It's like fresh off the press. I just went to a conference in Maryland and they came up with like, so there's the SISM model. Dr. Everly and Mitchell, they came up with it and it's been international and it works when done right. Some people say it doesn't work. I hate it. Our debriefings or I hate it. That's just because you have the wrong people leading. The wrong people were leading it or didn't know how to lead it, didn't have enough training. It works. And it's been proven to work over and over because they put it through the think tank to see how it reacts in your brain. Now, I got my little book here, this little, it's called Crisis Informed Peer Para Counseling Intervention Enhancement to the SISM Model. It's a long name. I'm like, long ass name here, but para counseling. And so they created this because it's like the whole reference guide to like how to be a helper of helpers. And this is exactly what I've been telling them. I'm like, who's struggling? Peer supporters are struggling because they're still embarrassed to say, I'm a therapist. I need help. I'm a firefighter. I need help. I'm a peer support lead. I need help. So they created this model. You know what's in it? I look at it and I was looking at it over and over and I'm a certified trainer. So I want to offer it to different departments and I'm going to do CAL FIRE in May. And then I'm just probably do online and do a bunch of, cause I want to train peer support in this. I want to train people to just have the cert, know it's okay and kind of what to do. The main thing on this training is self-resiliency and it's self-care for the first responder. So when I look at it and I had people look at it, they're like, it's kind of simple. And I said, I know it's that simple that we don't do it. It is that simple that how many of us go, yes, I do self-care every day. They're like, excuse my language, right? But that's a bitch. I need self-care. Be a little wuss, right? Right? I mean, if you don't say you're thinking it, right? You're thinking like, or else what happens? You're like woo woo, or they're like, they expect the therapist to be woo woo. I always say, I'm a little woo woo with a lot of science. So I'm never going to have you do anything that's going to be like too crazy, but just trust me, it's all for your brain. Without your brain, you're dead. That's what they call brain dead, right? It's the one organ that if you bleed in there, you're dead. So I'm like, we're slowly bleeding going, I'm okay. So when they developed this, I was looking at it and I'm like, man, it is that simple, but why is this so difficult for us? And so they named it para counseling. Why? Paramedics, para this, like it's in between to get a therapist, in between for a counselor. So their goal, and I'm glad that they recognize this and the ICISF is that you might not call me, but you're going to call your peer support. Now you're calling your peer support and peer support saying, I'm not a therapist. I don't know, man, dude. Like, I don't know. You need to go get help. And so a person's going to be like, oh, I'm not going to share anything anymore. This guy doesn't know what he's doing. And then that's where they want to train you to do enough skills to go, okay, let me hold you over to someone else. And that's kind of aligns with my goal, my vision, right? Like I like to help people. I like to get calls and tell them like, hey, here's my number. Call me anytime. I might not answer when my phone's asleep because I do set my boundaries in there. But if you call me 3 times, I'll know it's urgent and it always comes through. Someone called me at 2 a.m. and they're like, you answered, you called. Like, I know you called. In order for you to get through to me at this time, you called me 3 times. What's going on? And they're like, I'm having a hard time. This is happening. And I'm like, okay. So next thing you know, who am I calling? I'm calling their peer support. I'm like, hey, where are you? They're like, I'm on shift. What time are you off? I'm off at 5:30. Can you go to so-and-so's house? Can you help him out? He's struggling. Can we figure out how to get him into treatment? He's obviously not well, but he did reach out. And without peer support, like I couldn't do my job, right? Peer support shows up, does what they need to do. And like, all right, thank you. And I'm like, okay, we save a life? Yes, possibly. But that person reached out. They knew, let me call. Now, there's only one of me. So my goal is to also train therapists to be confident, comfortable with trauma, and to be like trauma informed, working with first responders. So we have in psychology, we do have, officers that are trained. We have more and more retired people going into the field of therapy saying, I want to help because I felt helpless. So for me, I'm like, hey, I'll help you. I'll tell you where to go, get the training, do it because there's only one of me. There's only a few of us. Like I can count how many therapists in my area that get it. So when we meet each other, we're like, yeah, you're my people too. You get what that's like. I'm also one of the therapists for the counseling team and the international counseling team. And I'm like, man, I love it because we're trained so well. Like, I'm like, these are my people. with first responder wellness. So linking up with all these programs and knowing the programs is super important. And I know California, and like you mentioned earlier, the one up north, but I also know a few in Texas. And it's like, who's there? What are they doing? Sharing the resources so that more people that need it there is help. One of the guys that I work with, he was a peer supporter. He said, when my wife told me there was a detox for only first responders, I thought she was messing with me. So she was trying to kick me out of the house. And I'm like, did you really not know there was that program? It's like, I didn't. But I was like, no way in hell was I going to be with general population. Those are the people that I arrested. And I'm not like them. Right. And in that moment, as a therapist, so I said, but in this moment, you are just like that. You are drunk off your ass right now. You are not doing well. Your wife's about to kick you out. In that moment, you're not that cop. You're not that firefighter. You put on the suit and you do the job, but you need help right now. But we're not going to put you with general pop. We're going to put you with your people so that you can say, I'm not the only one affected by this. I'm not the only one affected by this. I'm not the only one affected by that. Like, oh, shoot, you're right. Like, we have a similar story here. So we're more alike than different. But for me, it's super important. Like, just, being integrity, having that, like, life, what do you call it? Not life maturity, but being able to say, like, I need help. That's the hardest thing. So people are like, why do you answer your phone? I'm like, by the time someone calls me, do you think they sit around and go, let me call Dr. Maribel for help? No, they're like, fuck, I got to call her for help. And then I don't answer, right? So many times you call somewhere and they're like, or the voice recording, please leave a message. Nobody calls you back. You're not going to call back, right? So you're like, oh, I'm good right now, right? So for me, it's super important. Like whoever you call, whatever program, that there's someone there saying like, I got you, because that takes guts. Like, and I remember, like I said, I call 15 therapists, and the only reason I know the numbers because I wrote them all down. And I was like, oh, I got to give them the story. Of course, me, right? I was like, I'm good. I just need to call you because my school mandated it. I even gave myself my diagnosis. I was like, I have adjustment disorder with, life situation. They're like, some therapist probably looked at it and goes, this lady's crazy over here diagnosing herself. And then finally I was like, the diagnosis is just the lens for you to look at it. So sometimes, we do have to diagnose, and a lot of times people say, oh, you have PTSD. We all have PTSD. We all have PTS injury. So I'm big on like, yes, we have that injury. Yeah. Post-traumatic injury. We all have it.
I love that.
How could your brain?
Because me and my co-host Taylor would always, I used a word, I used to tell him, we used to talk about it all the time. And I love that word. I never heard that term before. But I would always say to like cops and people on the podcast, my whole thing was trying to get across was just like, hey, like, you don't have to see mental health as like a bad thing or like a big thing or a bad thing. It's just like, think of it like as like a mental health like injury. Some injuries are scrapes and some injuries are like, you need a tourniquet, you need to go to the hospital. And so I like the whole PTS injury because it's like, oh, that's kind of similar to what I'm trying to say. It's not like a disorder. It's just maybe smaller. It's just an injury type of thing. And that's kind of like the whole thing I try to get with mental health is like, don't look at it like this. It could just be like this. Something small.
Yeah. We jump to the disorder, which then goes to, there's nothing wrong with me, because nobody wants a disorder. I don't care. Like nobody goes around saying, please diagnose me with the disorder. Right? Like they're like, oh, of course we're depressed. Of course we're going to have an injury. Of course we're going to have this. But it's important. What do we do with it? Because I can just have it. One, I can use it as an excuse and go, of course I have this. Or I could say, you know what? Because I have this is what I need to do. Because I have this is what I need to do for self-care, whatever that is. Because of my job, I need to do this. Excuse me. Some people say, I can't meditate. You tell me to sit still and I can't sit still. Of course not. Your life depends on it. You got to go. Bell rings, this rings. You got to be high alert. So now let's teach our brain to relax. That's going to be harder than the job. Give you a gun. I'm sure you're like, oh, heck yeah. Hell yeah. Let's go for it. Tell you to meditate. They're like, oh, I can't do meditation. I'm like, oh, this is fun. This could be fun, because we're so used to going, but our brain needs that slow down. Our brain needs to slow down, right? Mm-hmm. I could get all to the science and be like, we have these GABA receptors and glutamate blocks and this and that, now we're a certain way, but it's like, okay, what do I need? What does my soul need? Like, I can go, 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 but can I slow down? If I can't slow down, what does that tell me? What do I need to do? And it's a training, right? It's just a training of what we need to do because all the risk factors, we know they're there. It's just, the pace, there's a downside to that pace and we can't keep it up. So what happens? You're going to be injured. It's just a matter of time. And we could say, I'm good. How many of us have like your elbow hurts or you're lifting weights and you're sore? Of course you're sore. That's the whole point of it. You're breaking down your muscle. You're supposed to get sore to grow. So the same thing with post-traumatic injury is, of course you're going to feel this way. You saw some abnormal situation, of course you're going to, and I can name some like significant incidents that even like I heard that I'm like, of course that's not normal, dude. That is not normal. So what are we going to do for our brain? But we go, oh no, move on. We're good. I'm good. It's like, no, you have an injury, but it doesn't have to be the full, like, let's lock you up because you're not good. We're going to take away your guns and your badge and this and that. And some people go to that, right? And that's where that caution and peer support is. It's like, can I get the right training to know like what level of care this person needs in there? And it's always good I always tell people, it's always good to have a therapist in your back pocket. It's someone to call and just like bounce ideas and say, look, especially, we have a lot of first responder therapists and, there's a website where they list the first responder therapists and we've all been trained. And it's like, get one of us in your back pocket to say, hey, what are your thoughts on this? I've had some situations where, one of them, and I said, man, I probably could get my license taken away. So maybe you're going to put this on there. No, I told them, hey, fucker, you kill yourself. I'm going to be fucking pissed. And he's like, what, man? Like, what therapist tells you that? He's like, what? You're crazy. And I'm like, no, if you fucking kill yourself under my watch, I'm going to be pissed. I'm going to be mad at you. And I don't know what I'm going to do, but I'm just going to be mad right now because you deserve better. And I believe you can get through this. And then I remember him looking at peer support going, she's crazy, man. She's mad at me. I'm telling her I want to kill myself. And I remember the whole time he's like, ma'am, miss, I don't want to kill myself right now. And I said, I know you don't. And so later on, I talked to one of my therapy friends, right? And they're like, you told the client that? And I'm like, what are your thoughts? Tell me if you're suicidal. I was like, no. At that point, the client needed like straight, like you said earlier, right? In integrity, like you are not going to do this, dude. I was like, you see this picture? That's your kid. You see this? That's your wife. You see this? Not under my watch because I'm not going to live with your death. But I externalized it. So I kind of knew what I was doing because I externalized it. What do you guys do? It's all about other people, right? No first responder goes in their right mind goes, oh, I can't run into the fire because I might die. I can't meet the bad guy because I might die, right? You're like, let's go. So I externalized it because it wasn't even about him. I made it about me. I'm not going to be able to live with my death in his hands. Like, and he can't live with the thought of him hurting me. So he's like, I'm not going to kill myself, miss, because God forbid I cause you problems. I'm like, yeah, buddy, for you, I don't care. Just don't do it to me. But part of it, and people will say, is that reverse psychology? There's no such thing as reverse psychology. People always say that your brain doesn't know how to do that. But we say things that like, I'm being true. I don't know what I would have done if he would have killed himself because I had never had that happen to me. And a client of mine doing that, then, you second guess. So the same thing with first responders is like when the call goes bad, you second guess. And that's when you need to step out. And I always call that zooming above. You need someone else to pull you out of that shit and go, okay, zoom out. It wasn't even your control. There was nothing you could do in that. Did you do the best you could? Yes. We all know, right? The risk factors are there. And then you pull yourself out and go, what do I need? If my body's a high adrenaline going, I need to slow down. If I'm depressed and slow, like I don't care about nothing. I just want to lay in bed when I'm off. Then you need to get up. So I always tell people, figure out like what your body needs and then go from there up or down. And you can't do it alone. When we're stuck in the mud, we can't pull ourselves out. It's like quicksand. They're like, the more you pull, the more down you go. That's when you need peer support. That's when you need therapy. That's when you need agencies, communities to kind of help you. So for me, I was telling you when we talked, like, I started a program with a lady called REST. Relational, emotional, spiritual truth. It's all about being integrity with yourself, connecting that disease and making sure like we have the connections. And it is that program. We do have the spiritual foundation, and we're like, hey, it's above you. It's like with God. How do we give it to God in that? And then there's, experience recovery, where it's detox treatment. So I have these treatment centers that I work with, first responder wellness. They're well known, right? So we have different ones, and it goes, a person might need more God in their life, or a person might say, fuck God. God wouldn't have done this. And then we're like, okay, our goal is eventually to get you to be like neutralized. I don't have to be F this, F that. I don't care, but I can be like, okay, I am mad. I'm mad at the situation. I'm mad this happened, but I'll be okay. And processing that. And that takes work, right? It takes work, and it takes people in your community. So I always tell people, find your 5. You don't have 5, then figure out who they are quickly. And like, be like, okay, is this my 5? Is this my 5? Because if you have 5, they're all there for different pillars. They're all there and can help each other. We all have pillars in our life. So they'll help us. This one might help you through this season. This one might help you through that one. That one's going to help you there. And then vice versa. And it could be peer support, or it could be others that don't. I have some peer supporters that have all the training, done that, and they're not on the official list of peer support. They're just like, I just do peer support. I help out my fellow peers. I help out my fellow people, like you said, because I don't want to see them suffering. And so for me, it's kind of like the same thing that, I know there's one of me, and I try to give back as much, but, spreading the word, training people, getting people to, even like you said, talk about it is huge. So I don't know, for me, like, I love what you do because you're out here doing it. We talk about it, and everyone has a skill. Everyone has a talent that we can just look back and go, how can I give? How can I give to me? Take care of me first. And then if there's time and space, take care of others.
Exactly.
That's so important.
I appreciate
Yeah.
that. And one thing with kind of my situation that I don't really talk too much about is when I started the podcast and I wrote my book, it really all came out of a moment with just myself. I was reflecting, and it came down to a question of like, I remember thinking about all the things I went through was not normal. Like being a cop and then doing the whole trauma stuff every single day, like that was normal to me. But my situation of losing a family friend and then getting into a shooting, and then one of my good friends and my mentor, the reason why I was even caught time and killing himself, like back to back incidents with 6 months apart, boom, 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 boom. I was like, this is not normal. Like to go through this situation. I mean, some cops don't even get in shootings their whole career. And I went through 3 incidents back to back to back. And I was like, I feel like it was like, I'm not a big believer in like, I guess like still trying to do the whole God thing, like with, whatever, that's a whole nother conversation. But it was more like, maybe I was put on this world to kind of go through those incidents, and I can either keep it to myself and not really tell, keep it to myself. I found a solution for myself, and I helped myself out because I'm very open to things. Or I could just, keep myself, feel better, move on with my life, or I could actually try to help others. And I was like, I think I'm going to go the other route and just help others. Yeah, it's not going to get back to me, but if I could help someone, if it's just one person, then great. If I could go on the podcast and record for an hour and one person listens, then great, And so that was my mindset, was like, if it just helps one person, that's fine. But I feel like what I went through was nothing normal. So I should just try to help as many people as possible. Some people might like it. Some people might think it's dumb. But at the end of the day, at least I feel good. So I took the other route rather than being selfish and keeping it to myself. And usually I feel like I would do the opposite. I would keep things, like, no, fuck it, I'll go my life and do what I gotta do. But it's probably the first time where I was like, this is just too big. Like this is something I have to kind of help out with and kind of get back.
Well, thank you for doing that. And thank you for sharing, because that takes vulnerability. And I think vulnerability is what makes us resilient. When we hide and when we like don't tell anyone what we've been through, that's when it starts chipping away at our soul. And there's nothing left. And even though we can't change certain situations and circumstances, eventually somebody might look at it and go, oh my gosh, I just went through the same thing, and this guy's doing okay, and he's working through it. That gives me a little bit of hope to be able to do that, versus that shame and blame. And we're such a shameful society, right? Like, especially with social media out, like we all want to call each other out on all the things and say, oh, but you did this and you did that. And it's like we're one-upping so that I feel better about myself. But at the end of the day, it's if I can be vulnerable and go like, that was a hard call. Like that's not normal. 3 big incidents in my life, whether it's personal or work, they're still in there and you're going through it. And it's like, we can only take so much. And you're trying to catch your breath and like, boom, underwater again, boom, underwater again, underwater. And you're like, okay, I made it out now. Now what do I do with this? And so it is important that we all share our stories. I am writing a book right now, and it's a little bit my story, but it's just a little bit education and people's stories out there, because the more we share, the more we realize that we're so alike and we've been through a lot of stuff, and it normalizes it for a situation that's not normal, but it normalizes that there is a lot of pain and there's a lot of healing, and that healing is what we focus on. I could sit here in my pain and I can just wither away or hide or have that shame, or I can take that and go, this is my story. And we all have a story. All of us have a story. When you really talk to someone and you're like, what's your story? Someone might say, well, I don't know what my story is. But if we're vulnerable enough, we have a story. And when you're hit like that, like constant, and I always say, like, why does it come in threes, right? It's like boom, boom, boom. And that can either break us, like you said, or you can say, okay, why me? Why not me? Why not me? Like, now what am I going to do with this? I'm going to come out here and do a podcast and share the story with others, or I'm going to write a book, or I'm going to be part of peer support, or I'm just going to get educated. And if there's an opportunity to do something, then I can be like a first aider. I don't have to solve everybody's problems, but sometimes you don't need the whole paramedics and the whole fire department, everybody to show up. Sometimes, like you said, it's just like, hey, I just need a Band-Aid real quick. Or, oh, you definitely need some antiseptic stuff, right? So that's first aid. Like, if we all take a look at it like that way, like we can all aid each other, help each other out in whatever situation's there without chipping away at our soul.
Yeah.
So I love that you story. Yeah.
Like you said too, like how you're saying people don't understand how like we really are. And it really comes down to, I learned that kind of statement really well going through my whole journey, because the more I started talking, people started opening up about their own stuff. But my biggest one where I learned that was when I went through my divorce, like almost 2 years ago now. I went through my divorce, and I remember when Tom was going through his stuff, their situation. Not saying that his separation from his wife was the reason why he killed himself, but it was a part of that stack. It was kind of like I always saw like the cherry on top. Like whatever he was going through, it could have been from the Marine Corps, it could have been a lot of issues they had relationship wise, it could have been a lot of other stuff as well. And then that one incident kind of just put things on top, whatever relationship wise that was going on. So when I was going through my divorce, and when my ex-wife had told me, how she was feeling, and she was like, I don't want to be with you no more type of stuff, it destroyed me. On the outside, I was like, all right, just keep it good and just like, be strong, you're that strong person. But when I was alone, the only person that ever knew how bad it was my best friend, Josh. And every day I called him pretty much like in like the worst, like cry, like pretty much the worst place I could be. And I remember telling him like, just be very vulnerable. And there was another person who been through a divorce as well. And I seen him go through a divorce. And I remember telling him, I don't think Taylor would mind if I share this, but so when I was working as a sheriff's deputy, Taylor was going through his divorce. I was a new cop, and I would go see him, and he, I didn't really know him that much at the time, but kind of be there for him. I never been through if I was married, but like, I know this guy's hurting and pain, and I'll go talk to him and whatnot. And I never seen what he was going through. I couldn't really imagine what it was. And even one of my mentors, Rod Schulman too, they're both in my book. I actually I went through 2 divorces with them. They're all going through their divorces when I was a young cop. And I would see it from the outside and be like, oh, it sucks. It happens. The military cop, I seen it happen my whole career, both careers. But then when I went through it, and then I was thinking about like Tom's situation, I never bring it up to Taylor. Like now I kind of understand why. And I told Shu this the other day too. I just told him about it. I was like, now I understand why, Tom did what he did. And not saying that I'm suicidal, but it's more saying like the pain was so bad, it was more understanding. Because when everything had happened, and that was just more like, again, I'm not saying that was the main reason, but when thinking about, I remember thinking about him taking his life, I was like, why would you do that? Like, why? But then going through that pain of being with someone for, 13 or 12, 13 years, and it was more like, now I understand, like this fucking hurts, and now I understand why someone would do it. And it sounds so shitty saying it out loud, but it was more of an understanding. And not that I would, but
Yeah.
it's just so crazy for me to actually go from like, why would anyone do this to like, now I understand why a brother or a sister would do this.
That's why I asked, like, why not?
Mm-hmm.
Right? Because when you get to the why nots, you go, well, why not him? Right?
But then that's the thing
So we look
too,
at
is like when he started to interrupt you, but it comes back to what you're saying though. If more people were more open about it, because when I told Taylor and Shu about it, it was like, yeah, brother, like this shit fucking sucks. Like divorces is probably one of the most painful things you'll ever go through. I remember them saying like there
oh yeah,
was painful things you ever go through. But no one fucking tells you that when you know, like you just see it and they're like, oh yeah, bro, I'm good. Like it's a divorce, I got that bitch, whatever, blah blah. But then now I'm going through it. It's like, why didn't you just tell me when you were going through that? It was my, hey bro, you good? Like, oh yeah, I'm good, this fucking whatever. She was like, but how about imagine if people were just for, it doesn't have to even be, it could be any situation, shootings, divorces, whatever you're going through. Imagine if people, that's why I learned it, but I was already doing it with the podcast, but it's like now I want to be as vulnerable as possible with people because it only takes that one person to open up. If I could be vulnerable and say it, and that person can now feel comfortable, be like, well, hey, I'm going through a divorce. So, hey, I'm going through my shooting, and this is how it feels now. And they feel more comfortably open up about it rather than just not saying nothing about it. Because I didn't tell no one. I was going through it. I went through it for 3 months before I went through it for a month alone before I told even Josh. So it's just me trying to figure all this stuff out. Because to me, I felt like I thought my marriage was like it's gonna go the distance. Like it was great.
well, yeah. Nobody gets married to get a divorce.
Yeah.
Nobody says, "Yeah, I want to get a
And
divorce."
then everyone who's been through it is more just like, oh, like it happens. But to me, it was more just like, well, no one's really been open about it, how they actually feel. It's always just like, you just see the outside, like, yeah, who cares? It's whatever, like it just happens. But then now we started talking about it because you're going through it. And now they're actually expressing, like, oh, no, bro, it's like one of the worst feelings you go through. It's like, oh, fuck, I wish I would have known that. Everyone else is just doing it like, that's whatever. But as a cop, it's so funny. You actually you'll go pick up the body as the sheriff's deputy coroner, and people are killing themselves all the time over marital problems and stuff like that. So, yeah, it's crazy.
Yeah. Well, it's a risk factor, right? So you look at the risk factor. So it's like the perfect storm. So that's why, like, you have all these things. So that's when I say, like, why not, right? So this person has PTSD, they have financial issues, they have anger. Now they have loss of significant relationships. Ooh, loss of their wife, their partner, their husband, whatever. So now you might have more financial, then you have kids, then you get sick, and then you come in, and we all come in with, we say, ACEs, so adverse childhood experiences. So the more ACEs we have, the higher our risk factor is, right? So then we've all experienced trauma. So you add on like the perfect storm, and then you go, why not? So that's where we need other people to say, hey man, let's add some hope. Like, I went through that shit. It was freaking hard. And at the other side of that, like, this is what's going to happen, And I always tell people, like, it's easier to stay in denial than to actually, like, face whatever you need to face, whatever that is. It's easier to be like, nah, it's all good. We're good. We're good. We're good. And like you said, inside you're like falling apart. And it's hard to say, you know what? I'm freaking not good, man. Like, my kids, I'm going to spend time with them, my wife, my money, my retirement, or like, let's say my mental health. Like, what about my guns? What about like, I'm not going to be fit for duty. And people say, why do you have first responders? I'm like, man, that's a tough population. Sometimes I question that. Sometimes I'm, man, I could go to general pop. It's easy. But then I'm like, because they're like me. I'm not a first responder, but I'm a helper of helpers. As a therapist, if I'm not good and I go see a therapist, I have to be very careful because even one of my peers could say she's unfit to be a therapist. My first therapy experience, right? The 15 one, after that one, I went to go see one. Actually, before that, so let me backtrack because even that, when I was younger, right? I was a victim. I went in, she called DCFS on me. And I sat there and I was like, did you call DCFS on me? And she's like, oh, well, you were a victim and your child was there. I'm like, I'm a single mom going through school, a victim of a crime, and you added to my stressor? You do not get me. She goes, but you're fine. We're gonna close out your case. I left like shocked.
Just the case.
And then, she's like, my case, right? And then she thought she was fine. And so then after that, I was like, what the heck? Like, either I need to be that person to actually change the system, because the angry part of me, right, would be like, fuck you people. I don't need this shit in my life. I'm never going to see a therapist. So that's why when I got mandated to see a therapist, I was like, oh my God, I just cannot see anybody because this lady did not get me. And she was of a different culture. And I don't mean like just by race, like she didn't get me. And so her little, maybe stereotypes or different like beliefs she had, they weren't aligned with mine. So it's super important to like have that alignment. And so that gave me that like wall of like, I don't want to see a therapist, but yet God put me to be a therapist. Cause I was like, I do not want to be a therapist. God, why am I doing this? Until years later, I was like, well, this is why. Thank you, God. I thank God now all the time. I'm like, okay, get it. So when I went through the 15 and then I had that other therapist, right? Finally found her. Well, that lady decided to retire. Damn. Right. And I was like, oh, what am I going to do? And I went years without finding one until I looked at what are the pillars in my life that I need. I did a life assessment and I'm like, spirituality is a pillar that I'm so low at right now. Because part of me was mad at God for different things. Part of me, I like had my life planned out. The other part of me was like, I don't believe in certain things anymore. I'm not sure. And when I really did an assessment, I was like, spirituality, I need that in my life because I'm seeing so much darkness that I don't know how much room I have for like light right now. And I happened to meet a coach. I still work with her. I go to group every Wednesday at 5:30. So you won't reach me at that time. Every Wednesday I'm in group. Even when I think I don't need it, I get something out of it. And I'm like, oh, that was so good. I needed that. Like, that was just good. Or it's just good to meet people. And at first I was like, oh, I can't let them know I'm a therapist, right? They're going to be like, why is she here? What's wrong with her? And then now they, right? And those are our own internal dialogues. Now I'm like, I don't care. Yeah, I'm a therapist and we're human and I'm here to grow with everybody. And that doesn't mean there's something wrong with me. It just means I want to grow. I don't want to be down here looking at my mud. I want other people, my group, to come bring me up and go, hey, have you thought about this? Have you thought about that? Hey, we need to check in. Hey, are you doing this? Are you doing that? And I'm like, oh yeah. So I always tell people, find your community, find your 5 people so that you're not alone. And sometimes in this profession, it gets pretty lonely. A lot of us are struggling with loneliness. A lot of us struggle with connection because the job, the time, the hours, just the stressors of the job. So it's so important. Find a group you connect with. There's different peer support groups out there. There's different programs out there. And, people don't know. They can call me and say, hey, I saw you here or I did that. And, I'll give you my number. I don't know if I could say it right now, but, I won't answer all the time because I set my boundaries. But, anybody can call me. I'll give you my number. It's 909. It's so easy. It's so difficult. So it's 909-678-9700. So my first digits are 6789. You'd be surprised how many people get so confused with that. They're like, what? Say it again. I'm like 9 and then 700. And I was like, my daughter was born 97. So 9700. That's funny. People are like, what? I made it easy so my kids, in case they got lost, they can always tell anybody. Mom's number is 6789-700 and then 909. Yes, I had it when I moved to the IE. I had to switch over to the IE from my 213 number. People are like, oh, 909. I'm like, yes, it's IE. And then Empire people, Blacks. Yeah. My kids, one time they were in Chicago. And so I taught my kids and I told them, I'm really proud of you guys. They're with their dad and they got lost in a big fair. So of course they found the nearest cop and they asked him, they're like, hey, we lost our dad. Can you call mom? I'm in California. They're in Chicago. And I had this guy call me. He goes, I'm calling you from Chicago PD. I'm like, what happened? He goes, no, I'm calling you from my cell and I have your daughters here. I don't know, what do you want us to do? And I said, oh, their dad will find them right now when he realizes they're lost or he's lost. I said, find a common place. And when he calls me, I'll let him know. But my kids were little and it was so funny because my kids are like, we know mom's number. And people are like, how do you know her number? I said, call me. But if it's in a real emergency, call 911 because I'm not going to be available to help you. So, it's so interesting how, we can see here, you and I probably talk for hours, right? About like the stigma and like just the reality of our lives.
Well, I have a bunch of notes here. We didn't even get through any of them. We just like, I love I got the thing I always tell people on the podcast is that's one thing I always talk about is finding a therapist. And if you don't find the right one, then just always try to find, always try again. Don't just let the first one dictate whether you think therapists are bad. It's not for you because you had to find. I was just in my situation. I was just grateful to get that perfect one on the like right off the bat. Not everyone gets that happen, but I understand. Just try and try again. But when I'm telling people like first responders to find a therapist, I'm thinking like, I liked you before you came on here, how we talk, but the way you communicate on here, I love you. Like you are awesome and you are the therapist that every first responder or veteran or military person needs because you talk exactly how I say. You need to find this type of therapist and you're exactly that. So I love that. Everything about
Thank you. Thank
and the
you.
fact that you're being real on a topic of being real, like that is exactly like the fact that you say like, hey, I need help whenever you're feeling a certain way. And I feel like sometimes I need to even work on that myself because not only with my incident with like, again, I went through this whole mental health journey, all the stuff I went through. And then I go through another incident, traumatic incident with my divorce or, like exactly me and my divorce. And then what I do, instead of doing what I know I'm supposed to do, I went right back to my old self and just kept to myself, didn't tell no one for a month, didn't tell my mom for like 3 months. People didn't even find out and that like people didn't even find out until like 2 months ago. Some people, they're like, oh shit, even it's been 2.5 years and you're barely telling me this now. Like that's how bad I got with the whole situation. But even though I know how I should do it, I know I should talk, I still end up not doing that. And even as a fitness coach right now, I've been doing this, 15 plus years coaching people, and I've had habits instilled with me since I was, again, 15 years now. But I'm
Yeah.
not perfect. There's days where I miss my water. I don't get my water. And there's days where I'll miss a workout now because I'm a go business. I have to focus on something else. And I am not perfect. And I do a lot of things that my clients do. I'm probably more consistent with how, more consistent on an every weekly, monthly, yearly basis than them. I am not just because I'm a coach doesn't make me perfection 7 days a week, every single day of the week. Like something's gonna happen. I'm just able to adapt and maneuver the situation because I've been doing it so long. And yeah, I think I would need to talk about that more to myself. Like, hey, like I fucked this up too. It's okay. You just adapt and move on and do something else. Like it's all right.
Divorce and being a marriage family therapist, I'm like, oh my gosh, she was like, oh my God, does that mean you're not going to be a therapist? I'm like, why? She's like, marriage and family therapist. I'm like, man, like that stigma is so real, right? Like that's so true. So again, a society, we live in such a shaming society. Like we don't know how to handle certain things, but the more we talk about it, the more we're like exposed to. And I had to tell her, I said, do you know who has the highest divorce rate? First responders, therapists, and doctors, like a dentist.
Mm-hmm.
And she was like, really? And I was like, yeah. I was like, because we deal with people and we sacrifice so much of ourselves that there's nothing left to give to the people that we love. And that's so important is like, we have to fill ourselves first or there's going to be nothing left.
Mm-hmm.
There'll be nothing left of us. And we run. And it's like, hey, time out. What do I need right now? And so for the last, I don't even know, maybe 5 years, like I meditate every day and people laugh at me because sometimes there've been some situations and they're like, I'm like, I got to go meditate right now. Like I have a 1 minute, 2 minute, 5 minute, 10 minute, 20 minute. I usually do my 20 minute because that's a full circadian rhythm of sleep. We can get into that later. I'm like, it's going to help me for 4 hours. But I'll tell you, when I first sat down, I was like, one, I didn't want to be a therapist because I was like, there's no manual of what to do. Two, I'm a go person. So you're telling me to sit still? I'm like, I don't know how to sit still. What do you mean, sit here and meditate? I don't want to hear the thoughts happening. And once I learn, like the thoughts are like a washing machine, right? Like I need to cleanse them out. So the more there are, the dirtier the shit is. Right? Imagine like even my coat or threw my coat on and I take it out. It looks nice, clean, greeny, but there's shit from all day. I've been running around all day. If I put it a wash, there'll be some brown stuff. That's like what meditation does to me. It gets rid of whatever gunk is on me. And then I'm able to like move forward. But I'm carrying that. I don't even know. We're carrying stuff all the time. If you're a first responder, you're carrying other people's stuff all the time. And then our own stuff. Right. Then we're just combating this. So we have to figure out what works. If that works, sometimes, I'll have my clients, they'll laugh at me because I'm like, yeah, I'm going to have the copper color. He's like, color? I had one cop I was working with and he kept ordering his color pencils. and they kept giving him glitter colored pencils. He was a commander, right? And he's like, you're gonna laugh at me. And I'm like, what? He goes, I got glitter colored pencils. I'm like, oh, you gotta bring those. He's like, no, seriously. I was like, fuck this therapist. And I'm like, let's color together, man. And we were coloring. And then I'm like, you cannot think of all that stuff that you bring in with you while you're coloring. Tell me if you could do it, because I can't. And then I'm like, that's the science behind it. So there might be some little like stuff to do, right? That you're like, if you have young kids, you get off shift, color with your kids. It's helping you probably more than your kids, because kids are more resilient. But that's a little thing, right? So for me, I always come up with like little things like, why didn't someone teach us this? I get mad at myself. Like, no one taught me this in school. You know, one of my first calls that I went to with Norwalk Sheriff's was a suicide homicide. And, you know, seeing those kids and screens and all that. And I'm like, I walked back, and one of my friends and we became friends after that. I tell her we trauma bonded for life. And we laugh about it because we're both therapists, right? And I told her, I said, this wasn't normal. You understand I wasn't normal? And we're like 21, 22. And I told her, no one talked to us about that incident. And I said, looking back at that incident, I don't think anyone talked to the cops there. Seeing those kids without a mom, without a dad, and the grandmas fighting, do you think that was normal? Like, that even cleaned up the incident. And everyone's fighting. Your daughter did this. Your son did this. Well, your daughter, if it wasn't your... And then here we're supposed to be the therapist helping out. I told her later on, I said, you understand like how traumatic that was for everybody. And we just cleaned up, went back. All right, next incident, next. And so now kind of backtracking, right? Going back to like, what are those significant events and how do we clean up that mess? And so I like the analogy of like every time I put my clothes to wash, I'm like, wash the clothes, but watch the shit that came off and what else needs to be cleaned in there. And then when I meditate, I do like there's a 20-minute that I love on YouTube, Release the Clutter. And people are like, clutter? What do you mean? I'm like, everybody else's baggage in mine, stuff that I'm carrying that I don't even know what it is. And I can do it now for 20 minutes. When I first started, I was too tired. I'd fall asleep, which was good. Give me feedback. There's no good and bad, just feedback. Those feedback. I'm like, man, I must be running on fumes if I listen to it and I fall asleep. Now, on my good day, I can listen to the whole thing without falling asleep. And I'm like, ooh, I've been doing my self-care. That's good. On a bad day, I go, man, I only got through that part. And like, I don't even know what happened to the rest. But I woke up when I needed to. And I just needed 20 minutes. And I'm like, okay, what else do I need today? So that's where the working out, calling your friends, doing healthy things. We call it friends and go drinking. They're like, okay, they're the negative peer influences. We all have those. We know who to call, right? But it's making those like good choices and being like, okay, I need to be outside. I need to read a good book. I need to do this. What is it that I need? Who do I need to call my 5? Who are my 5 people right now? And if I don't have them, let me figure out what I could be involved in and not sitting in the darkness by yourself. So I said it earlier. I love that quote by Martin Luther King that like, darkness cannot drive out darkness. Only light can do that. Light brings out light. Just like hate can only bring hate. Love can do that. So love starts with ourself. What does it look like? How many, oh man, you'd be surprised like how many people are like, I don't really love myself. I mean, how could you love yourself in a profession that's set up to be everything dark? And, so it's like, I have to counteract that and go like, I do love myself. And this is what I need to do for that. And I need to create things or talk to people and get out of that space of darkness down here. If I can't get out by myself, I get the ladder out, then I need people to prop me out. We send the helicopter out with the little hoist. Get me out of here, man. Those are your 5 people.
That makes sense because I feel like one thing that a lot of cops do in law enforcement is that they hold on to the identity of the shield of the badge itself and the identity of being a cop. When you just like what you said, one thing that law enforcement or cops, like the job profession is, it's dark, right? It's a dark profession. And you have to do what you have to do to do the profession. Whatever you see, whether it's you're seeing something or you're doing something that acts like it's going to be a dark profession, it's the real world. And I think one thing I did really well as a cop, but I always tell people all the time since one of the first episodes was like, I feel like I was a great cop because I was a bad cop. And what I mean bad cop is because I would not care about the badge and I did not care about the title of cop. I know the thing about it, so I always feel like I'm such fit. I do not care about being a cop, which makes me such a great cop because When I got my badge, I didn't even cry. And there's like people in the graduation like, oh my God, this is the hardest thing ever. To me, it was the easiest thing ever. Being a Marine,
It's a
yeah, being is a piece of metal, whatever, put it on, let's go to work. Being a Marine was something that made me like more emotional. And that's something that title that I still hold. And that's something that I always held on to since then, since I was 17, 18. But being coming to cop, I was like, okay, cool, give me the badge, let's go to work. Even after, I never cared about, like, the title never grew on me. I was like, oh, it's just, to me, it was just a paycheck. It's just a job. I could care less. And so I think that's why I never had that issue of falling into that thing, because it was like I never really held on to the identity, because it never really, I always wanted just to be Gilbert. So whenever I was working, when people are bad mouthing law enforcement on social media, are bad mouthing it to me, I'm just like, you don't affect me, because I don't even, like, I could care less. I could leave this job one day and they're not going to care about me. So you don't affect me. Like, whatever you say comes to this, is like, okay, cool. You're not talking about Gilbert, because Gilbert is this. And so it never bothered me. So I always went on with my career like it was nothing, because it didn't. I wasn't who they were identifying. I was just being Gilbert. So even when I worked, I just acted like Gilbert. How I talked was like Gilbert. I just did everything how I wanted to do it, and the place that I worked at allowed me to just be myself, which is why I liked where I worked at, because they allow their deputies to be exactly who they are. They don't make them like be exactly how they want them to be. They give them the freedom to work how they want it to work, which was perfect for how I wanted to be. Like, people, you still get a lot of guys who fall into that identity. So when something is going their way, that's getting spit at their way, it's smartly taking more personal when you don't have to, because that's not you. You are this person, you're that person, you are not the badge. You're going to leave this place one day, and that's not going to be you. So just get over it. Like, it's fine. So I like that.
You're so on it, because when you have other things beside the badge, then you leave when you retire, and that's no longer you. And a lot of people struggle with that. So you're so on it that, like, people need to take care of themselves, and people need to have those outside sources, and, be congruent, authentic, and find hobbies and continue to do what they love to do. Have friends in the department, but have friends outside the department.
Exactly.
You have friends only in the department. When you leave, you lose your friends, or you have an injury. And on about that.
Oh, yes.
But I want to thank you for the time. I know we've kind of stayed on longer here, and I do have to go. But yeah, let me know whenever you want to chat, and even if online or offline, it doesn't matter.
Oh, definitely. I want to get you on again. Like I said, when I saw the time, I'm like, holy crap, it's already been past. Like, to me, it felt, I do this a lot, but some podcasts, I'm like, I look up and it's like 20 minutes with like an hour. And then with you, I was like, it's probably been like 20 minutes. Like, nope, it's an hour or something. It's like an hour and 20. I'm like, I didn't even realize that. It's crazy. I love talking to you.
I talk for
So I would love to have,
like, I don't even get on my.
yeah, we didn't even get up.
Yeah.
I didn't even finish peer support. I still have more stuff on my notes here. So I was like, damn.
Just on peer support if you want.
Yeah.
We'll go on that.
But yeah, I love to have you back on, and I'll have one of the shows come back on, because they're going to love you, and we can finish more stuff. I can see this going on, even more episodes, but I really appreciate you coming on.
Thank you, girl. I appreciate you. Okay.
No problem.